Welcome back. I'm an emergency doctor actively working at the emergency department of my hospital. In this Doctor's Corner series, we'll dive into lesser-known approaches and hidden strategies to help the people with critical illnesses. You can subscribe if you want to learn the latest news and healthy solutions about your health. Let's begin with a simple but demanding idea. Recovery from alcohol addiction is not built by trying to become perfect. It is built by always trying to be better. Say that carefully. Do not demand perfection from yourself. Demand direction. Why? Because alcohol use disorder is not merely bad behavior, and it is not simply a lack of willpower. It is a medical condition in which alcohol can alter reward, stress, memory, and decision-making circuits in the brain. The National Institute on Alcohol Abuse and Alcoholism describes alcohol use disorder as a brain disorder that can be mild, moderate, or severe, and emphasizes that evidence-based treatment can include behavioral therapies, mutual support groups, and medications. So ask yourself, if the brain has learned alcohol, can the brain learn recovery? Yes, but how does it learn? It learns through repetition, environment, treatment, support, and meaning. It learns through many small corrections, not one dramatic promise. That is why always trying to be better can be so powerful. It turns recovery from a single event into a living process. It says, today, improve the next decision. Improve the next room you walk into. Improve the next person you call. Improve the next 5 minutes. Do not wait until you feel strong. Act in a way that makes strength more likely. Now, why is this approach medically sensible? Because alcohol addiction often survives through loops. A cue appears: stress, loneliness, payday, a certain street, a certain friend, a certain hour of the evening. The brain predicts relief. Craving rises. The body moves almost before the mind has finished arguing. NIA's neuroscience material explains that alcohol-related cues can gain strong motivational force because alcohol affects reward and relief circuits. The same brain plasticity involved in developing alcohol use disorder is also involved in recovery. So do not only ask, why do I drink? Ask a sharper question, how is the loop built? Then break the loop at its weakest point. If the store is the cue, change the route. If isolation is the cue, schedule contact before the craving arrives. If shame is the cue, speak to someone before the shame becomes secrecy. If exhaustion is the cue, protect sleep as if it were medication. Do not negotiate with a craving in the environment that created it. Move, call, eat, shower, walk, leave, replace the scene. This is not motivational decoration, it is behavior design. And here is where always trying to be better becomes clinically useful. It lowers the emotional cost of correction. Many people relapse not only because of alcohol, but because of the story they tell after a slip. I failed. I ruined everything. I am back at zero. Stop that sentence. Replace it with a clinical question. What did this episode reveal? Why did it happen on that day? How much sleep did I get? Who was I with? What feeling did I avoid? What plan was missing? Treat every mistake as information, not identity. But be careful. Do not use that idea as permission to keep drinking. Use it as a command to improve the plan immediately. If you slip, contact support the same day. Remove alcohol from the house. Review the trigger. Book the appointment. Restart medication if prescribed and medically appropriate. Go to the meeting. Tell the truth quickly. Speed matters. Now let's talk about treatment. Do not try to outthink a medical condition with pride. Get assessed. Ask for help. Ask directly, do I meet criteria for alcohol use disorder? Do I need supervised withdrawal? What medications are appropriate for me? What therapy should I start? Why ask about withdrawal? Because alcohol withdrawal can be medically dangerous. The American Society of Addiction Medicine guideline makes an important point. Withdrawal management by itself is not treatment for alcohol use disorder. It should be connected to ongoing care whenever possible, so do not confuse detox with recovery. Detox may clear alcohol from the body. Recovery rebuilds the life that alcohol kept invading. How do medications fit into always trying to be better? They can reduce the biological pressure that makes change feel impossible. A major JAMA systematic review and meta-analysis of 118 clinical trials found the strongest evidence for acamprosate and oral naltrexone as first-line medications for alcohol use disorder, usually alongside psychosocial care. Think about that. A person may believe, if I take medication, my recovery is not real. Reject that belief. If someone uses insulin for diabetes or inhalers for asthma, we do not say their effort is fake. We say they are treating a condition. Do the same here. If medication is appropriate, use it under medical supervision. If therapy is available, attend it. If mutual support helps, participate. If one tool does not fit, do not abandon recovery, adjust the tool. Ask, how can I make the next right action easier? That question is one of the most important questions in recovery. Make the healthy choice visible. Put non-alcoholic drinks in the refrigerator. Remove hidden bottles. Block delivery apps if they are a pathway. Share your danger hours with someone. Write your reasons for sobriety where you can see them. Create a plan before the craving arrives. Use if-then planning. Say, if I feel the urge after work, then I will drive straight to the gym. If I pass the liquor store, then I will call my brother. If I feel ashamed, then I will text my counsellor before I isolate. Research on implementation intentions. These specific if-then plans has found small but meaningful effects in reducing alcohol consumption and heavy episodic drinking. Why does that matter? Because the addicted brain often makes decisions under pressure. Do not wait for pressure to create wisdom. Decide before the pressure comes. Now, let's make this personal without becoming sentimental. Many people with alcohol addiction are not trying to destroy their lives. They are trying to silence something. Anxiety, grief, boredom, trauma, guilt, emptiness, physical pain, social fear. Alcohol first appears as relief, then slowly becomes the source of more pain. It promises a door and builds a cage. So ask, what was alcohol doing for me? Was it numbing? Was it helping me sleep? Was it making me social? Was it giving me permission to feel? Then ask the more important question, how can I meet that need without poisoning my future? If alcohol was treating anxiety, get anxiety treated. If alcohol was treating insomnia, get sleep treated. If alcohol was treating loneliness, build connection deliberately. If alcohol was covering trauma, seek trauma-informed therapy. Do not only remove alcohol, replace its function. That is a key point. Recovery is not subtraction alone. It is construction. Build health, build home, build purpose, build community. SAMHSA describes recovery as a process of change through which people improve health and wellness, live self-directed lives, and move toward their full potential. It also highlights health, home, purpose, and community as major recovery dimensions. So do not make sobriety your only goal. Make a life that sobriety can survive in. How? Start with the body. Eat regularly. Hydrate. Move daily. Sleep on a schedule. Get liver function, blood pressure, mental health, and medication interactions checked. Alcohol can disrupt nearly every system, so recovery must become whole person care. Then train the mind. Use therapy to identify distorted thoughts. I deserve one drink. I can control it this time. Nobody will know. I already failed. Challenge them. Write the counter sentence. Practice it before you need it. Do not expect clear thinking to appear during craving if you never rehearsed it during calm. Then strengthen connection. Join a group if it helps you stay honest. Consider professionally facilitated approaches, 12-step programs, secular recovery groups, family therapy, or peer support. The 2020 Cochrane Review found strong evidence that manualized Alcoholics Anonymous and 12-step facilitation interventions can increase abstinence compared with several other established treatments, while other approaches such as CBT also remain valuable parts of care. Why does connection work? Because addiction loves secrecy. It feeds on the private deal, just this once. Community interrupts that deal. A person who knows your pattern can hear danger in your voice before you admit it. Let people know you. Let them help early. Do not wait until the emergency. Now, keep the phrase "always trying to be better" clean. It does not mean always criticizing yourself. It does not mean living under a whip. It means becoming a better observer, a better planner, a better responder, a better patient, a better friend to your own future. Say this to yourself: I am responsible and I am treatable. Hold both halves. If you keep only responsibility, you may drown in shame. If you keep only treatability, you may become passive. You need both ownership and care. Each morning, ask 3 questions. First, what is my highest risk moment today? Name it. Do not be vague. Second, what is my protection plan? Make it behavioral, not "I will be strong." Say, at 6 p.m, I will be at my sister's house. Say, I will not carry cash. Say, I will attend the 7:30 meeting. Say, I will take my prescribed medication. Third, who knows? Recovery becomes stronger when someone else can see the plan. Each night, ask 3 more questions. What worked? Repeat it. What almost pulled me back? Respect it. What will I improve tomorrow? Write 1 sentence. This is how a person changes, not by hating the old self, but by training the next self. And if you love someone with alcohol addiction, listen carefully. Do not confuse compassion with covering consequences. Do not shame them, but do not protect the addiction. Say, I love you, and I will help you get treatment. I will not help alcohol keep its place in this house. Be steady. Learn about the condition. Support medical care. Encourage honesty. Protect your own well-being too. Why can this solution be effective? Because it matches the nature of recovery. Alcohol addiction is often chronic, looping, biological, psychological, social, and environmental. Therefore, the answer must also be repeated, layered, and daily. One decision is not enough. One apology is not enough. One detox is not enough. One motivational speech is not enough. But one improved decision, repeated many times, can become a new pathway. Let me close with this. Do not ask, can I fix my whole life today? Ask, what is the next better action? Then do it. Do not ask, why am I not perfect yet? Ask, how do I make relapse harder and recovery easier? Then change the environment. Do not ask, what will people think if I get help? Ask, what will happen if I do not? Then call the clinician, the counsellor, the sponsor, the trusted friend, the family member, the support line. Alcohol addiction narrows life. Recovery widens it again. And the bridge between the two is not magic. It is repeated improvement, medical care, honest support, planned behaviour, protected health, and the courage to begin again without lying to yourself. Be better today than yesterday. Be better this hour than the last hour. If you fall, rise with information. If you are afraid, move with support. If you are tired, simplify the next step, but still take it. Thank you for being here together. Take care of yourself, take care of one another, and I'll see you with the family in the next topic.